Good afternoon, and I'd like to welcome you all to the local COVID outbreak engagement board meeting on the 15th of December, 2021. As you may have noticed, I'm not the chair of this meeting, but unfortunately the leader cannot be with us today, Ian Ward. So as the vice chair, I am actually chairing the meeting today. Can I just say welcome? And thank you for coming along today. Can I also say that this afternoon the meeting will be webcast for live or subsequent broadcast via the council and the YouTube site that we have, and it can be used by the press or the public. So please, unless you want to hear what you've said, the information can be used. So can I ask those of you that wish to speak to indicate either in the chat box or by putting up raising your hands? And can I only ask you to speak when I call you in, please? But as you know, sometimes I do call people in, even if they don't raise their hands. But you guys know me by now, how I do things. Can I also ask you to please switch off your mic and your video, because sometimes it does affect the width banding when we've got all the cameras on. So can I ask you to switch those off, please? I have got apologies this afternoon from Councillor Ian Ward, and Councillor Bridget Jones can only be with us for the first hour. But can I ask, is there any other apologies this afternoon? Speak now. Errol,
I've got one from Councillor Bennett, Chair.
Okay, so we've also got an apology from Councillor Bennett. Thank you for that, Errol. And then, have we got any declarations of interest? Members are reminded that they must declare all relevant pecuniary and non-pecuniary interests arising from any business to be discussed at this meeting. If a disclosable pecuniary interest is declared, can I ask that whoever declares it, that you must not speak or take part in that agenda item? Any declarations will be recorded in the online details of this meeting. Can we now have a quick look at the minutes and confirm that the minutes from the 24th of November are an accurate reflection? Have I got any issues? To say it's yes, of course.
Confirmed.
Right.
Excuse me, sorry, somebody just put something through. Can I confirm that they're an accurate reflection of the meeting on the 24th of November?
Right.
Yes.
Agreed.
Agreed. Okay. So I will sign those off, Errol, as an accurate reflection of the meeting on the 24th.
Thank you, Chair.
Okay, we'll move on. Oh, jeez. Sorry about this. I've just lost myself. I've got about 3 different things going on, so forgive me for this. The next is Dr. Justin Varney, it's item 6. He'll be giving us a COVID-19 situation update. Justin is our public health director and he will present this item. So Justin, over to you. Thank you very much.
Great, thank you, Councillor Hamilton. And we've published on the Outbreak website the updated slides, but I will try and screen share them with colleagues so that I can take you through them. And I'm just going to comment on some of the highlight and key points to make colleagues aware of. So first of all, just on the vaccine rollout, and I know colleagues from the NHS will update on this. The vaccine rollout is going well, and we're seeing particularly good uptake in our elderly population. One of the things I think it is important to keep in mind, and I'll come to this again at the end, is that Birmingham is a very young population. So when we're looking at the vaccine data, it's really important to look at it by age cohort, because otherwise, because we've got so many young people, if you look at all ages, our vaccine uptake looks really low, but that's because we've got so many young people who have only just become eligible and, for example, aren't eligible for the booster yet. So it is slightly skewing what's happening. In terms of the overall picture, we are seeing case rates starting to climb. We've seen an increase of about 15 to 16% in the last week in case rates. We have a small number of confirmed Omicron cases across the city. What is interesting is that the case rate in our over 60-year-old population is not climbing in the same way as it is in our under 60s population. And our highest case rate remains in our unvaccinated child population, with some bleed through into the parental age groups. And this is a very similar direction of travel to the rest of the region. And the rest of the West Midlands. But we are tracking at the moment behind London, where there is much larger proportion of Omicron cases. When we look at the pattern of cases, particularly in the last 7 days, which is the map towards the right, the highest number of cases are in the north of the city, and we're starting to see some now in the south of the city. The east and the west of the city are remaining relatively stable. And as I mentioned to the board last time, I think this is a combination of vaccination, but also these are parts of the city that were hit very hard during the summer and spring of last year. So there's also probably some element of natural immunity from that infection. However, there are signs now that that natural immunity is wearing off, and some of those areas are starting to creep up. In terms of the case rates, that reflects the map in terms of the areas of the city that are most affected at the moment. And we're also monitoring what's happening in terms of the national infection position. And we are seeing a upwards trend. So we do look at data from other sources, not just from people testing. And that's really helpful, because it means if there are fluctuations in testing uptake across different bits of the city, we're also getting information from other sources to see whether we believe that the case rates from testing are giving us a true picture. And one of the important parts of this is looking at the wastewater. So this is sampling from the waste of the city that comes through the toilets from people's houses. And we're able to look at the concentration of COVID in the wastewater supplies. You'll see on the map there's slightly weird blocks in terms of the geographies. This is all about the sewage systems of the city, many of which date back to the Victorian era and don't really map on to the way we understand the geography of the city now. But it does help us pinpoint areas that are going up and areas that are coming down. And the thing that I would draw your attention to on the right is areas where they're red or yellow. They're areas where the case rate in the sewage water is rising. Areas shaded in blue is where it is falling at the moment. So overall, we're seeing some areas creeping up, some areas falling or staying relatively stable at the moment. In terms of the variants of concern, this is everyone, I think, very familiar with, around the concern around Omicron and the case rates doubling, which is now looking at 2 to 3 days for doubling. And this is important people understand. The concern about Omicron is not just that it's more infectious, but we don't know yet whether it's more severe or less severe. If it's the same level of severity as Delta, the same proportion of people end up in hospital, but it's more infectious, that means over the next couple of weeks, more people will catch COVID. And even if the same proportion end up in hospital, that means that more people will be going into hospital. And that's why there's this big push to get vaccination up and to remind people around washing your hands, wearing your face covering, ventilating and taking regular lateral flow tests to try and reduce the spread of COVID, because this new variant is more infectious, and that means more people will catch it. And that means a larger volume of people, even if it's slightly less serious, still will mean a larger pressure on the NHS. Just moving on to testing, we're fully aware that there are issues with the national booking system at the moment around capacity for testing kits. There are enough testing kits in the country. Think of this a bit like the issues we had with toilet roll and baked beans in the first wave of the pandemic. What's limiting it is getting from the warehouse into people's hands. And government at times has to turn off the booking system for an hour or two to just manage that flow. So if back onto the website, and we know on Monday, for example, they turned off the national website for ordering lateral flow kits for a few hours and then turned it on again at 8 o'clock in the evening. So do keep trying. The same is true for vaccination appointments. If you go on, there isn't an appointment available, leave it an hour or two, go back on, because more appointments are being added every day. As you can see, though, coverage of testing across the city is relatively even, and similarly for lateral flow. There's slightly lower testing uptake in the centre of the city, but as I said, because I'm looking at the wastewater data as well, I'm reasonably comfortable that we're not missing any surges in this part of the city. And overall, the testing rates are staying relatively stable, which is good news. Moving on to the case demographics. In terms of the age profile, as I've said, we have seen an increase in children becoming infected with COVID. Some of that's because we continue to test in school, so we're finding it. But I think a lot of this is because children remain unvaccinated, and therefore the virus is running out of places to go, and so is spreading most in people that are not protected by the vaccine. We are starting to see some bleed into the parental age group, and this is particularly amongst those that haven't yet had the booster. We know that with the booster, that gives you an extra level of protection. It doesn't stop you becoming infected. No vaccine is perfect when it comes to stopping infection, but it does stop you becoming seriously ill. And all of the evidence also says that it reduces your chances of passing on by up to 60% in some cases. So having the vaccine really does reduce your risk, not just of becoming very unwell, but also reduces your risk of passing it on to people that you know and you care about. And we have seen much smaller numbers of household clusters since the vaccination programme has rolled out than we did in previous waves. As I've said, the case rate in over 60s has fallen quite dramatically, which is really good. And we continue to see the largest number of cases being in our white ethnic group. But then when we look at this in terms of case rates, and that's important when we look at numbers against the total population, the case rates remain highest in our mixed ethnic groups, our other white backgrounds, so non-white British, white communities, and in our African communities. And some of these communities will continue to have lower levels of vaccination uptake. So it is really important in those communities that people do take up the vaccine, because it's clear that the virus is basically going after people that haven't got any protection. Moving on to the current situation in the NHS. I'm sad to say this is not improving, and this is why the NHS is throwing everything at vaccination at the moment. What we're not seeing is the numbers coming down, and that's really worrying. The closer we get into December, further we get into December, the closer we get to January, when the NHS in a normal year is under immense pressure, and then added to which they've still got a large number of COVID patients, and COVID patients still coming in the front door. So as you can see from the information in the slide pack, these numbers are not improving, and that's worrying. And that's why the NHS is going hell to leather on the vaccination programme, because if we cannot get these numbers down, and we see with Omicron really huge spread of the virus into January, that will translate into hospitalisations and potentially into deaths. And that has the real potential to overwhelm the NHS. Deaths have crept up slightly, but they are staying relatively where we would expect them to be based against the 5-year average. But as you can see from this, the red little bits of the bar relate to COVID deaths. And they are staying relatively stable, but they're definitely there in a way that they kind of disappeared over most of the summer last year and most of the summer of the year before. But we're nowhere near the levels that we had in the first wave or in the majors third wave. In terms of the situation patterns we're seeing at the moment, in terms of outbreaks, we are seeing some in education settings, but as you can see, they're spread pretty much across the city, and we continue to provide bespoke support to situations and settings where there are outbreaks of concern, and particularly working closely with our schools to provide very individualised advice to the school around responding to outbreaks. We continue our contact tracing work, and we've now expanded this. We now continue to work on this in several wards and expanding this to across the whole authority. Our case handlers are churning a very large number of calls, following up on people, making sure that we're getting that important information for test and trace to help let people know that they've been exposed so that they can take action. We continue to have a strong programme of communications and engagement using multiple channels and multiple vectors to talk to people, both through social media, radio, local TV, and direct engagement on the street and in communities working with our partners. We recently launched the Be Healthy Winter is Here campaign, which helps people prepare for the winter months, simple things that we can all do to support each other to be a little bit healthier during this period. And that did include some COVID messaging. And we've been looking and working with our providers around how we can further strengthen the engagement with communities through their leadership in the communities that they know best. I'm delighted we're now over 90 youth COVID champions, and I have to say the youth champions are fantastic. Yeah, as the vaccination programme has extended to young people, the youth champions have been really helping us to understand where young people's concerns lie, helping us to answer their questions and helping to promote awareness and understanding both of the vaccination programme, but also of testing and its use in schools, as well as in the community. So we continue to put a lot of effort into communication engagement. We work closely with the NHS, and we've been supporting the vaccination programme with some very targeted work on communication engagement in areas of the city with lower uptake. Working alongside the national team who've been supporting some additional on the ground engagement work. Continue to work with our faith leaders. I met yesterday with the leaders of our Black-led churches group and had some really great conversations with them, both about how they can help support the messaging, answering their questions that they're hearing from their congregations, but also talking to them about how do we make sure that as the NHS pivots to this mass effort on vaccination, that we're not leaving people who have health needs isolated and alone, and what can community organisations do, what can we do in terms of messaging so that people are aware of the signs and symptoms of serious illness, particularly being aware of conditions like stroke or heart attack. Well, in previous waves, when we've had the NHS has had to pivot in this kind of extreme way, we've seen an increase in number of people dying from conditions like stroke and heart attack, often at home because they didn't recognise the symptoms that this was something serious going on. So we're working with them and other community partners and with the NHS to get more messages out to help people remember some of the simple messages we have on things like the FAST campaign to recognise the signs of a stroke, or the information from the British Heart Foundation to recognise the signs of a heart attack, because it's important while the NHS is really focusing on the vaccine that we can do everything we can to make sure that when we need help, we're calling for it, but we also recognise what's a serious concern versus something which might not be quite as serious and can wait until this vaccination push is over. There's a lot of detail in the slide pack, so I've tried to bring out the highlights for the board, and I hope that's a helpful overview.
Excellent, Justin. I can't see any hands up, so I'm going to ask you just a really simple question. Oh, brilliant, Stephen. My question is, what are the basic symptoms for anyone that has that new Omicron virus? Have I said that correctly?
Omicron, yes.
Omicron.
I know. I wish they called them something simple like Tracy.
Exactly, or Deborah. I could do that. But anyway, in all seriousness, what are the signs? And if you've not been vaccinated, I've read that there are certain signs that are more severe. So could you just give us an outline? Because I think we would be interested in that.
Yes. So we continue to look at a national level about the signs and symptoms of COVID, and on a regular basis, I meet with the other directors of public health and the chief medical officer to discuss this and to check there are no changes. The current view from the national data is still that the signs with Omicron and the symptoms are the same as with Delta. So if you have a high temperature a new persistent cough or a loss of taste or smell, then assume it's COVID until otherwise proven and book a PCR test. We're certainly hearing that with Omicron and to some extent with Delta, people often had lots of other symptoms, so extreme fatigue, headache, muscle aches. The problem at this time of year is there's a lot of things like flu going around, which also have those symptoms. So if you have unusual symptoms which you feel could be COVID, get a test, is my advice. But the key signs you're looking out for are that high temperature or cough or loss of sense of smell or taste. In general, even where people have got the other symptoms, they've usually got the high temperature. It's the temperature that's often the common one that most people have. And we're continuing to look at this. It might change because at the moment there's still a relatively small number of Omicron confirmed cases in the UK. So we're still learning what it looks like in a UK population. But at the moment, still the same 3 as they were before. But if you're concerned, book a test and make sure it's not COVID.
Okay, thank you for that, Dr. Varney. Can we go over to Stephen Raybould, please?
So, thank you, Justin. That's really helpful information. The voluntary sector is involved in planning. One of the things that we need to ascertain is, do things need to be stood up before or after Christmas, certainly around discharge. The information seemed to be Delta wave in a winter period plus a small amount of Omicron. How long have we got until we get a Omicron wave in Birmingham?
This is where I move into crystal ball gazing. My sense, based on what we experienced last time, and you'll remember when Delta first came, Delta appeared in the southeast in London and then came up the train line into New Street Station and across the Midlands, came from Birmingham out to the wider region. And to some extent, I would expect Omicron to do the same. It's very high at the moment in London. And it's relatively low at the moment across the Midlands, but starting to rise. What I'm also watching quite carefully is in the Delta wave, Birmingham did this thing where we went up, we got stuck, we went up. Remember, we did this stepwise movement, and we're not doing a massive climb. We're climbing by about 15% and we're staying there, that kind of rate of increase for a bit, and then we're increasing again. So I think we'll probably follow that pattern. If we do, I would expect us, also given the mixing at Christmas and the New Year, that we will see a surge in cases around the second week of January. And that will then translate into pressures in health and social care towards the 3rd, 4th week of January. So if we can get everyone jabbed over the next 2 weeks, then we will cut off that pressure on health and social care at the end of January. That's why the race is on now. The original ambition was everyone boosted by the end of January. Because of Omicron, that's moved forward to everyone boosted before the end of December, because if we can do that, we can probably cut off the massive pressure the NHS will feel towards the end of January. So that's what I would expect to see. But it is crystal ball gazing. Omicron is a different variant, and it is way more infectious, and it reproduces itself so much faster, which is why people need the booster. It's not because your body's forgotten how to protect itself. It's because by the time your body's woken up the troops, Omicron's already reproduced itself and is coming out of your mouth and your nose. So by boosting up your troops and getting them ready before you're infected, you stop some of that onwards transmission, you get it under control. So I think we're probably looking mid to late January is when the peak will come for us.
Can I, before I bring Bridget in, and then we've got Paul Tilsley, Councillor Tilsley. Can I ask, Justin, the government talks about 1 million vaccinations per day. Is that even possible at the moment with the level of staff sickness? And I can ask the health service if you prefer, but with the level of staff illness, with what's going on at the moment, you've said the 3rd week in January. Surely, if we can't meet the targets the government is talking about, we'll see the peak before that?
So I think it's a huge ask, and I'm sure when Paul and Dr. Aslam talk shortly afterwards, they'll talk about the massive efforts that have gone on. I mean, and as you know, Councillor Hamilton, even colleagues like us who are a long time out of service are being nudged back into wielding and needling again.
I'm back in there next week. I'm doing 2 shifts.
I thought you would be.
I'm not looking forward to it, but I'm doing my bit.
Well, and I think that's a reflection of where we are. Everyone's doing their bit. The NHS is standing down all sorts of non-essential, non-urgent services to put the mammoth effort in. But it's not vaccination alone. It is also the things we each do every day. It's the putting the face coverings on when we're going shopping. It's using hand sanitizer before we go into a shop and when we come out of a shop, because everything you touch inside, you potentially infect and it potentially infects you. So hand sanitizing in and out really helps. It's about opening your windows before your friends or family come over and just airing the room out. And when they go, airing it out again. All of those things are little things that we can each do that will make a difference alongside getting the vaccine. So it's both. It's not either or. The vaccine's really important, but it's also the decisions we're making every day. The other one I should say, which is really important, is testing regularly. As I've said before, the vaccine's not perfect and it doesn't always stop you getting infected. So doing regular lateral flow tests twice a week or lateral flow before you go. If you are going out to a Christmas party, Christmas event, or you're going to visit friends or family over this festive period, please lateral flow before you go, either the night before or the morning of the event. Do a lateral flow and just make sure that you're not infectious and you're not spreading the virus when you don't know it.
Thank you for that. I will bring Councillor Bridget Jones straight in, the Deputy Leader. Bridget, over to you.
Thank you, Chair. My question is about hospital capacity. So whenever I've said to people that hospitals they're too busy, they're full of patients, I get pushback saying, no, they've got a bed free here, they've got a bed free over there. But in reality, we know that they are struggling to cope. What would you say, is my question, what would you say to people who say, no, the hospitals are doing okay, they've got spare beds here and there, not everybody in the hospital has COVID, you're overreacting? What would you say to the people that give that kind of pushback?
Yeah, so I think a couple of things. So one, we've designed a health service now, which is a bit like the way we've designed the rest of the world. It's kind of just in time. So we've got just enough beds for what we need on any given day. And anyone who's waiting for a hip replacement or even a cardiac bypass surgery will know that they're waiting for a date, but they've got to ring up the day before and double check that the intensive care bed or the high dependency bed is free for them to come into hospital to have their procedure, because they need it for the 12 or 24 hours after the operation. And if that bed is taken by a COVID patient, then their operation gets cancelled. It's not that the general surgical bed isn't available, it is, but the oxygenated bed, the bed that helps them after surgery, is taken by someone who needs that machine to help them breathe due to COVID. The hospitals are under a lot of pressure, and the reality is that 120 odd patients in university hospitals with COVID at the moment is taking all of the spare capacity that the NHS would normally have and have worked really hard to get coming into winter. Because at this time of year, when it gets dark, unfortunately, we do see more people having accidents on our roads. As it gets colder, people with heart conditions, with respiratory conditions, often get sicker and end up going into hospital. And unfortunately, people's mental health often suffers as well. So we do see more inpatients coming in with mental health issues. And so the NHS usually over November works really hard to empty out as much as possible from the hospital to give them a bit of slack. And COVID's filling that slack. So, that's the bit that's really, really tense at the moment, is any of the give that we would have in the system for winter is gone. That COVID patients are sick and they require oxygen, and that takes the beds that we need for people that are having elective surgery. So that's causing lots of problems for other conditions. And of course, COVID is affecting NHS staff as well. So the hospitals are struggling and are impacted by sickness absence as well. So all of those three factors going on means that it is difficult for our hospitals. This is about making sure that when people have accidents, when they have heart attacks, when they have strokes over the next 2 months, that the NHS can do what we want it to do, which is be there to support people and be there to give them the help they need. And if COVID's taking all of that spare bandwidth, then there's a real risk that doctors and nurses will have to make some difficult decisions. So I don't think what we're doing is overreaction. I think it's the sensible and pragmatic thing to do to make sure that our NHS is able to weather the winter and make it through so we all have a good spring together.
Thanks for that, Justin, and thanks for that, Bridget. Can I bring Councillor Paul Tilsley in, please? Paul, can you ask your question or make your point?
Yeah, there's 2 points. The QE have got 100 ICU beds, and as we saw from the information that Justin just gave us, 25% of those are on ventilation. So it just gives you a rule of thumb, the pressure that QE in particular are under. The other point is something that I'd be grateful if Justin could put in the next COVID update from Public Health, and it's the issue that he mentioned about heart attacks and strokes. And if you can put that in a very simple, readable, digestible format, we can get that out to the general public.
Yes, thank you, Councillor Tilsley, and thanks for doing the quick maths for me. We will be putting something out through the champions, and I'll make sure that goes out to members as well. I really encourage people, we've got some fantastic campaigns, particularly the FAST campaign on the symptoms for people to recognise if they're having a stroke. And that kind of thing to get into people's heads. If you have someone whose face drops, who has problems speaking, who can't move their arms, that's the time you need to ring an ambulance. And when you talk to 999, you need to say that to them. So part of this is also about helping people understand the words that for healthcare professionals on the other side, if I hear someone say, my gran, she said she had a headache and now her face is drooping and she can't lift her arm, I'm immediately going to, this is a stroke until otherwise proven. Whereas if they say, oh, she slumped a bit and she's a bit tired and she's not communicating, it's those understanding the words that help us as healthcare professionals understand what's going on as well. So we will be getting some stuff out, hopefully at the beginning of next week, and I'll make sure that goes to members as well.
Thank you,
Councillor Hamilton.
I am also a champion as well, Justin, as you will be aware.
Well, thank you for that, Paul, and all the other champions, because in Birmingham, the last count I had, it was well over 800 champions. Justin, how many champions have we currently got?
I knew you were going to ask me that.
Yeah, you should know this, my friend.
No,
it's about 850
so,
of them.
Yeah, so we have 820 community champions,
we
have 90 youth champions, and we have 20 business champions who are supported by the Chamber of Commerce and working specifically with our business community around how businesses play their part in terms of responding to COVID as well.
Fantastic. On that note, Justin, I'll take you off the spot for a few minutes and we will then move swiftly on to the next agenda item. Can I now bring in, we're going to be talking about the vaccine rollout and uptake, and we will bring in, I may say this incorrectly because my pronunciation of surnames is not the best, but we will bring in Simon Dubley, the Director of Primary Care and Integration at Birmingham and at the CCG, and also following Simon Dubley, we will bring in Munir Aslam, the Director for the Black Country and West Birmingham CCG. So can we start with Simon, please? Over to you.
Thank you, Chair, and it's Simon Doble. That's
Doble.
fine.
Oh God, it's even
Don't worry.
easier than I
Don't
thought.
worry. Don't worry.
Fantastic, Simon. Won't
Thank
get
you,
that
Chair.
wrong again. Simon Doble. Thank
So
you.
I will screen share again a bit like Justin and just to show people what we're doing. And apologies, these haven't been shared in advance. That we're working at speed at the moment. But if I do that quickly, and just to just reiterate what others have said, that was a fantastic update from Justin and really helpful context really about what we need to do in terms of supporting capacity and demand through as well in particular. So overall, in terms of a vaccines overview, obviously we've had the Prime Minister's announcement on Sunday, and Justin already referenced that what this does is it drives the need for the boosters to be given through by the end of December now. So all people over the age of 18 will be eligible for a booster. That period of time between the second dose and the booster dose has been reduced from 6 months down to 3 months. Second doses have now also been extended to 12 to 15-year-olds, and age 16, 17 scheduled to receive 2 doses 12 weeks apart. What we've also set out in there is the primary dose for the clinically extremely vulnerable, and that's getting 3 doses, which is then followed by a booster dose. Still the idea to co-administrate with flu vaccines where possible. However, the principle obviously not being followed of delaying one vaccine in favour of co-administration. And there is also then the school age immunisation services, which is vaccinating the 12 to 15-year-olds. Also capacity on national booking service, the NBS, to book in 12 to 15-year-olds as well. So the key changes then to the programme that we've seen over the last few days. Firstly, that the NHS has been instructed to reprioritise to have vaccines delivery as the first priority, followed by urgent and emergency care, and that's for all the reasons that Justin's just set out. So I won't repeat those. The interesting thing yesterday, which you may or may not have seen, is that the MHRA has reviewed and temporarily suspended the 15-minute observation wait for mRNA vaccines. So that's for Pfizer and Moderna. What that does then is it allows far more people to be driven through the vaccine program as quickly as possible in terms of operational delivery on the ground. And then the thing that I'd already mentioned, so the period between primary course completion and the booster has been reduced down to 3 months. So in terms of how are we doing that then, we have within Birmingham itself, excluding the West, we've got 23 PCN LVS sites. And they're offering both the what's called the evergreen approach, so that's your primary course of vaccine, but also all of the booster campaign as well. What we've also then seen for that prioritisation exercise, there's been letters received through from NHSEI supporting some of the QOF changes, which are part of the quality and outcomes framework changes within general practice. And locally within our own local improvement schemes, we've just made the emphasis of those on risk assessment and prioritisation of patients, just to try and free up an element of capacity to support the vaccine programme. There's also 28 community pharmacies across the system offering first, second and booster doses. In terms of the larger vaccine centres, outside of Birmingham, we have one live on Solihull High Street. Capacity is now available at Millennium Point, and that capacity is being expanded. And then there are additional centres both at New Street Station and the Fort Shopping Park that are opening very shortly. All care homes have now received a visit. Plans are in place around mopping up patients who may not have received a first booster, i.e. that they're a recent hospital discharge or weren't eligible at the time of the first visit. All of that is being followed up. And the provision of boosters to housebound, which has been challenging, and one of the main issues of the challenging nature of that had been the 15-minute observation requirement. That really is being emphasised and pushed and wrapped around, particularly by the community staffing teams. In terms of headline numbers, that slide just gives you the overall number of vaccinations that have taken place as at the 10th of December. So closing in on 2 million vaccinations across the system. And then finally, in terms of booster uptake, this one He's varying all the time because of the changes in those who are eligible to boosters, and that's why I haven't got that cohort breakdown this time round. I will make sure we've got that for our next meeting. But you can see there, as it stands with booster numbers, we've got an uptake as at the 15th of December of just under 52% of the population. So if I drop the slides there, and I'll bring in Mania.
Hi, Councillor and Simon, thank you for that. So clearly there's a challenge here. We were on a booster programme and we've been asked to accelerate that. The capacity to do that we will find, but it will be compensated by us not being able to do other things. And throughout the pandemic, we've been delivering in the vaccination programme in general practice, around 70% of the vaccinations have been delivered by GPs. So we'll continue to support that. Booking wise, we know that through the National Booking Service or through 119, and then there'll be a range of walk-in sites. I would encourage, particularly in West Birmingham, for people who have not had a vaccine to think about getting their first vaccine to get some level of protection. The booster vaccines are clearly remain for those people that are beyond 3 months after their second vaccination. So currently within West Birmingham, we were delivering around 600 vaccines per day of the booster vaccines, and that was for the 50+ age group. Given the 18+ advice that we were given regarding people that are 18+ that need a booster vaccine, we've got around 60,000 vaccines to administer. Now, clearly there's a discrepancy there between those people that are going to have a booster vaccine versus those who have not had any vaccination. So we're covering a population of around 220,000 people. Many of those are children, but we have significant gaps in those people that have not had any vaccination. So I would encourage those people strongly to have at least some level of protection going into this winter. For us to be able to deliver 100% of the uptake, we'd need to deliver something like 3,000 vaccines per day. On Monday, following the advice, we got to around 800. So we're significantly behind in terms of where we need to be. We are ramping up capacity, and as Simon alluded to there, we've got a number of concessions that we've been given in terms of reducing the planned work that we do in general practice. But we need to bear in mind that if you have an urgent need, general practice is absolutely there for you. So don't put off getting in touch with your GP if you've got an urgent need. We talked about very urgent needs in terms of calling an ambulance, but if you've got an urgent need, if you've got a chronic disease, if you are having challenges around your health, please get in touch with your GP. We are absolutely open and available to you. That clearly will be in the same format that we've done previously, so a telephone call followed by an arrangement of the appropriate health professional to either see you or to liaise with you either further on telephone or by video consultation. So please do not put off your urgent needs because you think we're too busy doing something else. We absolutely have capacity to do that. So we've got a number of vaccine delivery sites. We've got 16 community pharmacies. We've had to deal, Councillor Hamilton, with our vaccination programme differently in West Birmingham, just given the needs, and we've adapted to do that. We haven't got exactly to where we wanted to, but we have got a range of offers now. So 16 community pharmacies. We've got the City Hospital site is open again. We've got 11 GP pop-up clinics, and there'll be a significant number increasing on top of that as well. We've got 4 GP practices that are quality assured, and we'll start to use our extended hours and additional clinics to deliver the vaccine. And we have been asked to deliver vaccines over Christmas Day, New Year's Day, and the bank holidays over the new year. So in terms of the national challenge that we've been given, we will do that. And so there will be an ability for you to book, but don't just be clear about how you book. The National Booking Service or through 119 is the way to go about booking an appointment. And there, like I said, there will be some walking capacity as well. We've been working with the Community Trust to deliver housebound vaccines or vaccines for housebound patients, and we'll continue to do that. The 15-minute wait has been a challenge, but that will significantly increase the throughput, because I think there are 2 challenges for us. One that we need to get through booster vaccines in a timely way, but we do not want to allow people to congregate. So in terms of if they are trying to get a vaccine, we do not want to give them COVID at the same time. So we'll need to all all of those things that Justin highlighted in terms of face, space, wearing a mask where it's appropriate, and washing your hands on a regular basis, or using alcohol gel on your hands on a regular basis, really important, because we are going to have to increase the throughput of seeing people to offer them the vaccination. So the challenges for us, we've got a considerable amount of vaccine hesitancy that persists, and we need to challenge. We do need to challenge that, because ultimately it is holding us back. We really don't know what the Omicron variant. We've still got Delta, so both of those will potentially cause an increase in hospitalization in those people that are not vaccinated. So there is a significant challenge, and we know that even if you are doubly vaccinated, you can still get Delta, and we've seen quite a lot of that. We hear from the evidence that Omicron double vaccination won't protect you against getting Omicron and then transmitting it to other people as well. So caution, we would say, to take an air of caution around. I think we describe Christmas parties, but I think any kind of gatherings for the winter now, please be as safe as you possibly can. We will try to deliver all of the booster vaccinations that we can. But if you've got a need, and I really need to reiterate that, if you've got a need, we are not too busy. We've got capacity to see you. We want to see those people. We want to prevent those people with chronic diseases, particularly, exacerbating and ending up at a point where hospitalization is the only offer that we have for them. And that's clearly not what we want to do. We want to preempt people becoming unwell. So we've got some. We'll continue to increase the capacity around the vaccines, and we've got enough vaccine. That's the other point to make. We are not going to run out of vaccine. We've been promised enough vaccine to deliver all of the boosters. So, yeah, we'll look at doing anything that we can to increase the uptake. For those people that haven't had a vaccination, we are there. We will absolutely provide a vaccination for you. We'll try to get rid of that, get through all of our patients that have had boosters, that need boosters by the deadline. If we run over, we run over, but we will try to get through to the number that we need to get to. So I hope that's helpful, Councillor Hamilton.
That is fine. Can I just ask a question while others are thinking about it, and they will also ask a question? I know that there are some excellent plans that have been put in place, and I also know that through public health and the voluntary sector and others, we have worked really well together to ensure that we get the correct messages out there and we're delivering on this vaccine. One, the plan that's in place, is this for the whole winter or just for the next 5-6 weeks? That's my first question. And my second question, you raised a really valuable point, Dr. Munir, regarding hesitancy, and we've got to do things differently. You highlighted a couple of things that we were doing slightly differently in West Birmingham. Simon, I just wanted to ask yourself, are we doing anything slightly different in BSOL so that we can ensure that some of the people that we need to get in, even to get their first vaccine, that they are now starting to trickle in, even if it's not in the large numbers at the moment, but we're starting to see them. Could I ask you to respond? Points, please.
Yeah, happy to do that. If I come in first, maybe on the first and the last point, and then Munir picks up the middle. So on the first point, certainly we will have capacity there to see us through and an ongoing process around if there are any boosters missed or if people want primary vaccine outside of this push for December the 31st to get as many people boosted as possible. That's a given, Councillor. We will do that, Councillor Hamilton, absolutely. So that commitment is there across a number of pillars. What we're doing at the moment is making sure we really are ramping up capacity to deliver on that December the 31st ask. And that's why these measures have been put in place, really specifically around that 3 or 4 week window. And that's for all the reasons that Justin articulated when he went through his slides. In terms of are we doing things differently? Absolutely, we are. And what we recognise is the different measures that we need to take to support the different communities that we have within Birmingham, and that is a must do. The fantastic information that Justin went through in terms of all of that community engagement piece is key to that. And my plea and my message to all of us, the members of this group and broader, is how we make sure that those messages flow. and we really do activate and motivate our communities to really drive vaccine uptake, capacity won't be an issue here. What we need to make sure is we're getting that demand through to meet that capacity.
Thank you for that, Simon. Dr. Munir, have you got anything to add?
Yeah, I was just going to say, we've done, and you've been part of it, Councillor Hamilton. We've done lots of work around hesitancy. We've done lots of engagement with faith groups and other groups that sit within our communities, and they've done a great job. We've asked them to reinvigorate that work that they're doing so that we can get more people vaccinated. And Stephen Raybould was at the Ladywood and Perry Bar forum on Tuesday. So we're not only going to ask them to do it, but we're going to support them financially to be able to re-engage with faith groups and other groups within the community. See if we can start nudging. We are increasing the number of vaccinations. It is slow for those in terms of the evergreen offer. In a sense, the booster offer is kind of easier for us because those people are not vaccine hesitant. Really, it's those people that have not had a vaccine at all that we need to continue to support to make good decisions here. Because actually, to protect us all, we need to protect those people so that they don't become unwell with COVID and then end up in hospital and require support. So I think we will redouble our efforts. We won't give up on a single person, but we do need to, like Simon has said, we've got the capacity to give everybody a vaccine, and we'll do that throughout the winter period. So the boosters, yes, we've got a challenge, but we'll continue to have vaccination appointments throughout the winter. So whenever people have made a decision to have a vaccine, we'll enable that to happen. But we really need to focus on those people, or continue to focus on those people that are vaccine hesitant.
Thank you for that. Very, very interesting. Thank you both. Can I bring Richard Burden in? Richard, over to you.
Thanks very much, Chair. And my question is also about capacity, really. Both you and Justin, when he was giving his earlier presentation, talked about the call up of volunteers from previous rounds to assist with the effort over Christmas and into January. And I'm just wondering, I mean, how is that going? I mean, Simon said we're okay on capacity, but I mean, how close to the limit are we in terms of just numbers of people in vaccination centres, whether vaccinators or administrators? And is there anything more any of us need to be doing to try to secure more personnel to do that?
So thank you for that question. I think that's really important. We're wrapping around this, so we've talked about general practice and what general practice are doing. The CCGs are certainly looking at what element of redeployment of staff they can offer through to certainly to the PCN sites. That likewise, that is happening across our NHS providers as well to make sure we've got workforce there. But I would agree, anything that we can do to encourage volunteers to come through and support the process would be invaluable. There's a number of either marshalling duties, administrative duties, all of those fantastic roles that people did in that first blitz of vaccine delivery, over the earlier part of the year. I think we ought to be looking to support. So I would agree with that.
Is there some way we can advertise that a bit more? I know sort of anecdotally that word is doing the rounds, but if we need lots of people quickly, we do need to address how that's going to be advertised to beyond, if you like, the usual suspects.
Yeah, we will push any of those routes out through the central programme and make sure people are sighted on those routes. But absolutely, yes. So that's coordinated in the most efficient way.
I think just in terms of a bit of reassurance, we're asking Health Education England as well to release some of the medical students and GPs in training to be part of the vaccination push as well. So everything that we can do in terms of getting vaccinators, but the vaccination programme isn't, like as Simon has said, it's not just about the people administering the vaccines, all of the structures that sit outside it. So there's lots of capacity to help people to do that. I think one of the points, Councillor Hamilton, I think it is worth making is that we don't know what the implication of a surge in Omicron will mean in terms of the HR resources that we have, so the people that work within practices and within vaccination sites. So we're not clear about that, and the guidance is, I think, is still pending in terms of if you are infected with Omicron, and then what's the period of time that you'll have to isolate, and the impact that will have on our health services as well. So clearly that's going to be a significant challenge going forward. So really it should reinvigorate people to think about getting a booster.
Absolutely agree with you. Thank you for that question, Richard. Brilliant question from all of you this afternoon. Can I just say, we in the council, and I know the voluntary sector, are here to support the effort that the NHS, what you're trying to do. Now, if there's any help you need, anything you want us to support you with, as the council, we are prepared to offer, as you all know. But I'm just saying that publicly because I think under the level of pressure we've all been under, you've done a phenomenal job. So we just have to keep pushing that extra mile. Now I'm going to bring Stephen Rayball, because I do think the voluntary sector are phenomenal, and it's people like Stephen and the way he can really harness that support that can really help. So Stephen, I'd like you to come in. I'm sure it was Stephen that are you still with us, Stephen?
I am, yeah.
Brilliant.
I'm still here. So just to say, obviously, we will amplify the call for volunteers, and we'll keep putting that out over the next few weeks. There's a couple of other elements that I think the voluntary sector can make a useful contribution. One is around encouraging those that are around organisations to come and take part in the vaccine programme, whether they've had the vaccination previously or they've been resistant. And then I think in the new year, as Dr. Oslam mentioned, we're going to do targeted activity around those that haven't come in for their boosters, but also looking again at those who haven't had vaccinations at all, just to get them in. But it's all hands to the pump. We're also obviously preparing for the impacts on the NHS and thinking about how to support discharge in the new year, because we know that there's going to be a pressure issue there as well.
Thank you for that, Stephen. Really appreciated. Now, Dr. Munir and Simon, thank you very much. Unless there are any other questions, we will be moving on to the next agenda item. Now, the next item was public questions, and that was there were no public questions this month, so we've got no questions to ask. So we will move straight on to item 9, which is Dr. Justin Varney. He'll be talking about test and trace and the budget and overview. So Justin, could you just present that item, please?
Thank you, Councillor Hamilton. So you'll see in the paper that for the board, as we said, we've been doing a piece of work to make sure that we've aligned all of the spend correctly against the COVID funding. And as colleagues are aware, we've been quite successful during the pandemic in securing additional funding on top of the core funding, and that's given us a healthy reserve, which is really very much stuff that we brought into play as we've been coming into this further wave. So I'm now reasonably comfortable that we have a clearer picture of the budget, which suggests that we are in line with the planned spending, and that we have got the right amount of money to see us through whatever comes between now and September next year, and ensures that we have both the specialist public health capacity, but also the additional support from enforcement and environmental public health and our communications colleagues to ensure that we can support a safe and successful Commonwealth Games, because whatever happens with Omicron for us over the next 2 to 3 months in the UK, of course, with the Commonwealth Games, people will be coming from all over the world to Birmingham. And so we need to be cognizant of the pandemic across the world as well as within the UK. So I think this rebalancing of the budget puts us in a good position for that, and also hopefully gives the board clarity about where we are in terms of the financial position moving forward. As you'll note in the clarification note, there are still a couple of lines where we're just finalising it, but overall the position is where I would want it to be facing the next phase of the pandemic. Happy to take any questions on the budget, Councillor Hamilton.
Any questions? I don't happen to have any questions, because I have to say Justin has done a phenomenal job with the budget this year. He has worked miracles, absolute miracles with that budget. He's been like a dog with a bone, and whenever he comes to me, it's as if he's protecting that money with all his life. So I can assure you that that particular budget and the budget lines, he has ensured that the money is there to ensure that we work, support and protect the public right up until and after the Commonwealth Games. So well done for that, Justin. You've done a great job. And unless there are any other points or questions, we'll move on to the next point. If you hear a dog in the background, I've got a little cockapoo thing here belonging to my daughter, and she's now making a lot of noise, so I apologize. Is there any other urgent business? No, silent. I think you may have an hour back this afternoon. So the last point is the time and date of the next meeting. The next COVID outbreak engagement board meeting will be at 2 o'clock on Wednesday, the 26th of January, 2022. It will be an online meeting, and we will do this all over again and a bit more. But can I say to you all, please have a blessed Christmas. And for those who don't celebrate Christmas, Hanukkah, or just enjoy the festive season. But more than that, stay safe, do the distancing, put your masks on, keep your hands washed as much as possible. And at Christmas, we're not saying not to enjoy Christmas, but just be careful that you're not mixing with too many people. At the moment, I'm going to the panto and they've given me a list of instructions that we have to do. And I think it's all really important that we follow what the experts are saying at this time. So have a blessed Christmas. At the new year, I'm not a great drinker for those that know me, but if you do have a drink, have the first one on me, and we'll do it all again in the new year. Have a lovely afternoon, and I'll speak to you all soon. Bye.